Good morning, everyone. Thank you for coming today. I want to welcome you to our first panel. And this panel is covering research and programs that are happening right here in Elkhart County, where we're conducting research to learn more about the mental health of youth and elevating Latinx and immigrant voices in our research. So today we have two panelists. You're going to hear from Dr. Margarita Alegría first, and then Liliana Quintero, and then there'll be time for questions at the end. And so I am Jen Burke Lefever, happy to be working with MHIM on this event and joining in with the Northern Indiana Hispanic Health Coalition. I'm the managing director of the Shaw Center for Children and Families, which is a research unit at the University of Notre Dame, and we were a happy participant and supporter in some of the research that you're going to hear about today. So, first up, I would like to introduce Dr. Margarita Alegría. She is the chief of the Disparities Research Unit at Massachusetts General Hospital and the Mongan Institute, the Leonard Endowed Chair at the Mass General Research Institute, and a professor in the departments of medicine and psychiatry at Harvard Medical School. She has spent her career examining how to reduce health disparities for populations of color, immigrants, and linguistic minorities. Dr. Alegría is currently the PI of 3 National Institutes of Health research studies, building infrastructure for community capacity and accelerating integrated care, building community capacity for disability prevention for minority elders, and Latino youths coping with discrimination, a multi-level investigation in micro and macro time. She is also PI of a Robert Wood Johnson Foundation grant assessing opportunities to establish institutional policy and systemic changes to increase racial and ethnic diversity in academic health sciences. She has published over 300 papers, editorials, intervention training manuals, and several book chapters. In October 2011, she was elected as a member of the National Academy of Medicine in acknowledgement of her scientific contributions to her field. She has also been a recipient of notable awards, such as the Simón Bolívar Award by the American Psychiatry Association, the Rema Lapause Award by the American Public Health Association, and the Lifetime Achievement Award for Latino Behavioral Health Research by the National Latino Behavioral Health Association. Most recently, Dr. Alegría received the 2022 Inclusive Voices Award by the American Association for Public Opinion Research. She received her BA in psychology from Georgetown University and her PhD from Temple University, and we are so very excited to welcome you today, Dr. Alegría.
Thank you so much for having me here. It's really a pleasure to be part of this panel. And partly we wanted to do it, and I want to recognize the Shaw Center because they're the people here that have helped us throughout. They're actually people that have been interviewers in this room. So I'm very grateful that this is a community project that I'm hoping to talk about, but it's really done with folks here. I want to start very quickly saying that one of the most important things is that there is a mental health crisis. And it's really important to try to think as a coalition, what can be done here in Elkhart and St. Joseph and in South Bend to try to deal with it. It's around the United States. It's not something only here, but it's such an issue that people are now very worried about what they can do. I told the group yesterday of policymakers that one of the things we're doing is we're actually having a meeting of all policymakers, a bipartisan group of policymakers. Actually, we're meeting in Aspen to try to think what are the policies that are needed at the national level to try to deal with this problem. I want to say why we have to focus on children and youth when discussing mental health. First of all, most mental health problems start when kids are very, very young. Anxiety starts between 6 and 11. So there are things that happen very early on. Most of the data that you see here from the national study that was done by Ron Kesley and Kathleen Mary Kangas show very high rates of kids showing problems very early on. One of the issues we're having in the United States is the rates have been going up and up and up, and we don't exactly know why are we getting higher rates of mental health problems in the youth. If you look at national statistics, one of the things that's really important is it looks pretty good for the elder population, although that group is also increasing. But for the young population, especially children and early ages until 25, it's an increasing trend. And that's what we are so worried about, because those are people in their early productive years, and if we lose them, it's really going to be problematic. I also have to tell you that mental health is the #1 issue for children. It's not, not other problems, not chronic health problems. It's mental health now, the #1 and the most costly issue that we are paying for. It's mental health for children. The other thing is we know about adverse events. The adverse events, the ACEs that people now talk so much about. Many youth, when we look at national data and even data from Indiana, you can see that the rates are quite high for ACEs. We also know that immigrants often have better health throughout all the national statistics that we look, tend to have better health even with lower socioeconomic status. However, this advantage disappears as time goes on. And that's what people call the acculturation hypothesis. And it's worrisome because why would they get worse mental health as they're here when they're having opportunities for social mobility, they're having issues? But we see that both mental health and physical health deteriorate over time for immigrants in the United States. And even though we do a lot of advocacy trying to do behavioral health, we know that a lot of immigrants don't get access to mental health. Actually, today I was getting breakfast in the hotel, and the lady heard me, asked me what I was doing there, and I said, oh, I'm giving a few conferences on mental health. And she said, oh my God, God put you in my path. I need mental health. Can you help me? So, it's really, and obviously I said yes. I gave her my phone number. I gave her a connection. I talked to Gilberto, we have to get people in. And she said, I have no insurance. I don't know where to go, but I need mental health. I think I wanted to show you some data from Indiana. There's this report that is Kids Count, and it really collects statistics and does surveys. And one of the things they found is students reporting feelings of sadness or hopelessness almost every day have increased from 29% in 2016 to 36% in 2022. So we're seeing a third of the kids saying that they feel sadness and hopelessness, and this is something we should be concerned about. We also see that the parents, 27.6% of parents, say it's very hard to get access to mental health services for their kids. This is, I'm gonna go very quick because I have so much, I only have 30 minutes, so this is gonna be, I wanna make sure that I'm going slow, but I wanna show you some data about ever felt so sad or hopeless for 2 weeks in a row that they stopped doing usual activities. And you can see this is kids in Indiana, in the whole state of Indiana. But you can see there the rate goes from 31.4% for 7th graders to 36.8% for 12th graders and 38.8% for 11th graders. So you can see very high rates of these things. The last one that I'm going to talk about is suicide. Ever made a plan about how to attempt suicide in the past year? And you can see the rates going from 11.4 for 7th grader to 12.9 and 13.7 for 10th and 11th grader. So pretty high rates of kids thinking about making, and this is Indiana. This is data I want to show you about Indiana. So, and we're seeing this trend. It's not only Indiana. We're seeing this trend, very worrisome trend, about what's happening to our kids. I also want to show you, you probably won't be seeing on that piece, but I do want to say that 55% of US schools are really trying to do at least a screening for kids. The problem is we don't have where to send them. And doing screening without where to send them is even worse. I tell people, don't do screening. Actually, if you're going to do something, do anonymous screening, but get a profile of the schools that have higher problems rather than the kids that have higher problems. And then try to do interventions at the school level rather than individually. Because if you don't have the support to treat kids one-on-one, that's not a good idea. And we know that especially in rural environments, they're less likely to have resources. So now with telepsychiatry and telemedicine, we can try to get near them, but it's really, really important. I wanted to also emphasize the importance of school-based services, because if you look here, specialty mental health settings, it's actually the one that you see there that's high, but it's not enough for the population that we need. The blue is actually in the education settings. And you can see it's almost as high of what kids get in specialty mental health. And having school-based services is critical for these kids because many of the parents don't know that their kids have mental health problems, but the kids do report them, and you're gonna see this when I present. What are we missing? Why did we do this study? And one of the few things is we don't really understand what is leading to this mental health problems. We really have some hypotheses, but we don't know. So one of the things is seeing in this study that I'm gonna tell you about the developmental dynamics over time that could explain what's happening to youth, and trying to then see what are also the assets or the protective factors that we have at the individual, family, and neighborhood level that we could use to try to help the kids. So that's the general idea. One of the areas that a lot of literature has come back and has been done is showing discrimination, the experience of discrimination, discriminations in the school, in the neighborhood, as really central things that have affected many of the outcomes. That's why we focus in this study in discrimination-related stressors, to try to understand what's going on. And I can tell you one of the things that people asked me yesterday in the meeting is where is it coming from? And social media, vicarious is one of them, but there's also things at the school level and at the neighborhood level, and it's important to try to deal. So this is Seguimos Avanzando. It's a study that was run here in Elkhart, South Bend, and St. Joseph. And I really want to appreciate the community being able to join in and allowing us to assess, because it was with this data that we're interested in finding what processes mediate the links between discrimination-related stressors and mental health outcomes in daily and yearly level. And I'll explain what that means. What protective factors can buffer these effects, and how do parent stressors and neighborhood characteristics impacts youth mental health? Because we know that youth mental health is not only individual, it really depends. Saulo did a wonderful exposition, how communities could have such a big impact on how youth feel in terms of being included or excluded. And that's something we need to learn more about. This is a multi-time scale longitudinal design. It is 3 waves of data following the same children and the same families over 3 years. So it's a developmental. The idea is to try to see what is the developmental trajectory of these families and kids over time. And we actually collect data every year. We're actually on the path of finishing the 3rd wave. I'm going to present you data from the first wave, but we actually finished wave number 2, and we're almost on the path of finishing wave number 3. We also collect a 21-day diary to try to see what it means to do micro time. Micro time is to ask the youth every day for 21 days. We ask them to fill a diary to try to understand what are the dynamics in real time that are happening and how are they affecting not only their mental health, but their sleep. Because we wanted, sleep is super central in achievement, in mental health, in so many aspects of youth development that we wanted to check on that. The families were recruited from community-based organizations, churches, mental health facilities, schools. Everywhere we said to people, we gave them information. We also worked with advocacy groups to help us and youth organizations. It's 344 families, kids ages 12 to 16, and 2 caregivers. We wanted the caregivers to be included to hear from them what was happening to them also, and how would that impact the youth mental health. The project staff screened families for eligibility. In this study, and people ask why, they had to be Mexican American. And the reason is there's a lot of difference across Latino groups. And so for the purposes of this study, it was Mexican Americans. I think it would be great to do a study that's more inclusive of other Latino youth to try to see, do we see the same patterns or not? And then, as I said, it's 3 waves of data. I want to show you the mean age. The kids are 13.5 on average, as you would expect. Mothers are 41 years of age, and fathers on average are 44 years of age. You can see here the sample of youth is pretty much equal, girls and boys, so we have a lot of information. You can see here most of the families obviously identified as Mexican American, but one interesting thing I want to raise to you, and I'm going to raise it in the next one, is most of the youth were born in the United States, almost all, 93%. Compared to the parents, 92.5% of the parents were born in Mexico, and 94%, this is the mothers, and 94.9% of the fathers were born in Mexico. So you can see here that the parents are US born, and Mexican born, and the youth are mostly US born, which brings together the tension of having 2 cultures between the parents and the youth. Most of the families, 80% of the families are 2-parent families. This is a rate I'm going to talk very quickly about, higher than typically we see in other Mexican studies. I want to show you quickly the results of the findings that we got. Nearly 1/3 of the kids that we survey say they had elevated or highly elevated depressive symptoms, so around 1 in every 3. We found 44.5% of the youth having in the past 3 months elevated symptoms of generalized anxiety. So the issue with anxiety is more. And I have to tell you, this is very, very similar to what we are finding nationally. The rates of anxiety are going up, and, but still the rates of depression are not low. But we have to really think about anxiety, because sometimes anxiety is the first stage, and then it goes to depression. And so we want to try to be very preventive of our youth. I also want to show you that more than half of the sample of youth was categorized as having poor sleep. Sleep is something that we typically don't have a problem with Latino youth. Actually, it's seen problems with sleep tend to be highest in Black youth. But here we're seeing quite high numbers of youth having sleep problems. And so this is one of the areas I also think we have to think forward. The findings that we're getting are higher than a previous study that was done with the same Latino families, not the same original families, but a very similar sample in 2017, we're finding that the rates are higher in both depression and anxiety from the rates that were in 2017. So that means, we need to try to figure out what's going on. The anxiety rate, for example, is something that worries us because why are kids being so anxious? What's in their environment that puts them in anxiety? And then the issue that almost 18% of youth are really reporting having emotional problems it's also important. There are amazing discrepancies between parents and youth in how they rate their youth mental health. One of the findings, which is actually not very different to what we have actually published before with other samples, both in Texas, in Massachusetts, and in North Carolina, is immigrant parents tend to underestimate the mental health problems of their youth. The youth provide very high rates compared to the parents' perception of the youth mental health problems. And we think, at least there's a lot of suggestive literature that kids don't want to overburden their parents with their problems because they see their parents having a lot of problems themselves. Right now, for example, in one study that we have, kids selected as the problem they wanted to work on, this is a civic engagement, civic leadership, mental health for their parents. So, and this tells you the kids are seeing their parents stressed out. And so they don't want to tell them. But communication between youth and parents really makes a huge difference. And the issue really needs to be, how do we create areas to help? I'm going to jump to talking about protective family because I don't have that much time, unfortunately. But I wanted to say that racial ethnic discrimination plays a big role, and it's something not only for Latino youth, it really shows for all immigrant youth. And so we want to think about what can we do in the neighborhoods, in the community, in the schools? How can we make sure that we include people and they have a sense of belonging? One of the risks of discrimination is internalizing that you're worth less, and using a strength-based approach and assets really makes a difference. I'm going to talk about a study that was done actually by Christine Valentino right here, showing there are 3 areas of protective factors that have been shown in the literature that we tested. One is familism, which is family interdependence, loyalty, and sense of duty. And I was saying yesterday that we find that familism is really great for kids at the very early stages of their life, but it switches to be not so helpful when youth become early adults, because the demands of the family, because of familism, tend to be very strong. Family cohesion tends to be also very, and that's the bonding, the emotional bonding that families have. Eating together, for example, has been shown to be very helpful. And then ethnic racial socialization, teaching families how to deal with and coping with socialization of having pride for their country, having pride for their values, being ways. What they found is daily associations observed between discrimination and youth report of distress were very related. So the more discrimination, the worse it was, and familism and family cohesion were protective. So that's important to know. Because I have very little time, I'm just going to go to the next one. The other aspect that we found is exposure to violence was very related. Youth exposure to violence, either in the family or in the neighborhood, was very related to youth starting substance use. So this is an area like smoking, like drinking. So it's an area we also should be paying more attention. And what we found is this: the more people have exposure to violence, the more at risk they were. And community violence, it was the community violence expressed by the youth, not by the parents. The parents didn't really know how much the youth were experiencing violence compared to how the youth portray it. I think you have to, I'm going to finish saying this is a great group to start a coalition of people here in trying to see what can be done by policymakers, community groups, and actually academic groups that can join together and try to decide what are the priorities for this next round to try to deal with anxiety, with sleep problems, and with a sense of belonging in youth, so we don't have this type of problem. I think we need to improve access to care and having some ideas of how to improve as a collective, more systemic types of interventions than one-on-one interventions, because I don't think that's gonna really make it. And there are great interventions out there. That's the other thing I want to emphasize. Great interventions. I wanted to talk about behavioral activation by Malik and problem solving that by Michelson. There are two interventions. They have been tested with minority groups and shown to be extremely effective. So it's not like we don't have interventions. It's that we don't disseminate it and train people on the ground to do those interventions. I think family engagement is critical, at least to do this coalition. We need the families to really be part of it and also to get engaged in treatment. And family, I think school-based mental health services is a big key, at least, to try to get people into care earlier rather than later. And there's lots of national efforts now that are bipartisan to try to get money to the schools and trying to get early prevention. So you should all get together a coalition to apply for those funds. This is really important. You're gonna have this presentation. So thank you so much for having me.
Thank you so much, Dr. Alegría. And she will be available at the end of this conversation for some questions. And so now we will hear from Liliana Quintero. Liliana has served as Executive Director of the Northern Indiana Hispanic Health Coalition since 2005. Through her leadership, Ms. Quintero has advocated for the equity, health, and well-being of the Hispanic community and remains at the forefront of healthcare initiatives that respond to social determinants of health. Her work has been recognized through many awards locally and statewide. In 2019, she received a Key to the City of Elkhart for her commitment and public service to the children of Elkhart. Most recently, Ms. Quintero received the 2023 Preventionist of the Year Award from the Indiana FSSA Division of Mental Health and Addiction. Ms. Quintero is from Colombia and holds a BS in Electrical Engineering and a Master's of Science in Industrial Engineering, as well as an MBA from Indiana University. So please join me in welcoming Liliana, and I'm hoping we can figure out, you have slides? Okay.
Buenos días nuevamente. It is a pleasure to be here, and thank you, Dr. Alegría, for that excellent presentation, excellent background of all the statistics, because sometimes we think that mental health is an issue that doesn't touch us, doesn't touch Indiana, doesn't touch Elkhart, doesn't touch Michiana. But as you share with us, it's a serious problem. Let me see. No moving. Do I have to do here? Okay. So I'm gonna, during the presentation, I'm gonna talk briefly about the NIHHC, and specifically, we're gonna be sharing the results of a Bienvenido youth program that we have been providing to the Elkhart Community Schools and Goshen Community Schools. This is a research study. We're gonna have a little overview of the program, the study overview, data collection, the quantitative and qualitative results of the analysis that we developed with the support of two researchers from Ball State University, and some of the recommendations. Very quick, the mission of the NIHHC is to improve the health and wellness of underserved communities by providing preventative health screenings, education, and advocacy with a primary focus on Hispanics. I know that this circle looks busy, but for the ones who are not familiar, or some of the ones who are familiar with the NIHHC, usually people think about NIHHC with health fairs. So that's why we have the health screenings on the top. So one of our health fairs was at Elkhart Central High School. We gave away 10,000 free health screenings, 1,200 attendees, yes, 1,200 attendees. We have 300 volunteers, and we had 120 healthcare providers donating time. That was an excellent event that shows the needs. Because when you had the first person in line at 4 in the morning that is speaking loud, it's not because they don't have nothing to do on a Saturday morning. So, and we had people coming from 25 cities, 2 states, and like 13 counties. So with these health screenings, so this is what people understand from us. But then we also analyze data. As I mentioned before, we love numbers. That is the reason that I am in the job that I'm doing. So we do the metabolic syndrome analysis that I know that Dr. Rose can explain more in detail, but I'm gonna try my best. But then basically they use like 5 factors, and with that 5 factors, that is like LDL, triglycerides, waist circumference, blood pressure, and I forgot another one. If 3 out of the 5 are at risk or borderline, the person basically can have a heart attack or a stroke tomorrow. In average, when we had that baseline data, it's between 12% and 15% of the population that fell in that. 12 to 15. So we are talking about 1,000 people. We are talking about 150 people that can be at risk of that levels, extreme levels of heart diseases or stroke. So then we start running all the educational programs and start the physician referrals. So that is kind of what I wanted to point at very quick about the coalition. We have been in service for 20 years, serving Elkhart, Noble, Marshall, and Kosciuszko County with local offices in Warsaw and Elkhart. We serve in average 3,500 people per year, committed to cultural and linguistic, committed to serve the community with a cultural and linguistically competent staff. So one thing is to speak Spanish or be bilingual. Another thing is to be cultural competent. That is huge. So then I wanted to point at that. Over 300 volunteers, and we had the trust and the loyalty of our community. So we take right now our database of, I would say, 5,000 community members. 90% of the phone numbers are good. Why I say that? Because that is the way that we work. We work through WhatsApp. We work through direct messages. And they trust us. And they follow us. And they attend the events because they know that we really care. Data-driven and always, always looking for partnerships, like today is a great example. We have 3 pillars when we are talking about the NIHHC. Number 1, mental health. That is the reason of this speech. Number 2, chronic diseases. And number 2, chronic diseases. And number 3, the health screenings and vaccinations. You know, I don't know if you're familiar with the word COVID. Sounds familiar? So during COVID, we had to take that leadership to be sure that we increase the rate of vaccination among Hispanics. I perfectly remember talking to Dr. Weaver from IDOH and saying, Liliana, they are reporting that Hispanics don't want it to get vaccinated. And I say, no, it's not true. The community, the ones who are serving the community are not approaching them correctly. Give me the opportunity. And we increase the vaccination rate. If we use just the pediatric, at that point when Dr. Weaver approached me, it was 3.5% pediatric rate vaccinations. And we moved it to 19.5% because the trust, because the loyalty, because they knew that we were serving them, and because we were in a crisis. It was pandemic mode. And thanks to that relationships is that we are able to do what we do. And that's why we are able to impact the community as a whole. Because each time that people ask me, how is your people doing? So I hope that next time that I see any of you guys, don't ask me that. How is our people doing? Happened that we had blacks, blue, brown, Hispanics, Creole, So then it's our community as a whole that we need to advocate for. Now the research study. So as I mentioned, we did this study between January and May of 2022, and this is our picture. I wish I would speak more about our team. So we had a data analyst. We have 2 PhD doctors, one with a specialty in qualitative analysis, one with quantitative analysis, an intern as well with public health experience, our internal team. So what is Bienvenido Youth? So what do we do during these classes? So we start receiving phone calls and emails from the school corporation giving the fact that they were receiving a lot of more Hispanics, in average 2 to 3 new Spanish students a week per school. And they didn't know what to do. You know, it was like a crisis. We don't have the resources, we don't know what to do, we need help. So then we start implementing this program during the school time and with the support of the school corporation. So we cannot do anything without the partnership of Goshen Community Schools directly or Elkhart Community Schools. They help us to identify those kids that are new, arriving to the country, and how we can help them. So when we have those kids identified, so we are talking about emotional health, we are talking about alcohol use and abuse, we are talking about anger management, we are talking about trauma, we are talking about suicidal thoughts, that everything that Dr. Alegría was mentioning before. Self-esteem, risk factors and protective factors. Coding, we see a lot of coding in our kids as a coping mechanism under the stress that they are facing. But something as well that I wanted to mention here before I forget is that we realize that the speeches or the formal presentations were not enough. So we start bringing one-on-one individualized sessions. That is what Dr. Alegría mentioned. So we include that. So in average, our kids receive between 4 and 7 sessions with social workers during the school time, helping them to overcome that kind of trauma that they are bringing, helping them as well to create some coaching skills. Because sometimes we say, oh, those are Hispanics, they're not gonna, just help them to get a job in the RV industry. Yeah, but why has to be in the factory? Yeah, the RV industry, they can be an engineer, right? They can be an accountant. They can be a teacher. They can be a nurse. Yes, they need to push the English, but they can do that. So we had 9 sessions, once a week, and Spanish, completely given in Spanish. And the nicest thing is that sometimes we assume, oh, we go to Goshen High School, all the kids know each other. Know each other. Happen that no. This is even an opportunity for some of those kids to be together and say, hey, I didn't know that. I didn't know you. Oh, look, you're from Venezuela. How do you call over there papaya, right? Nicole, oh, lechosa. We don't even know things. But that creates a little lifting to our kids because say, I'm not alone here. When they are interacting with maybe third-year schools in high school with the ones who just arrived. I was just talking with my colleague over there that he was saying, we were talking about how it's like a little turtle. Thinking a turtle, they had the little house here, and they show the head here and say, where am I? What am I doing here? And then Chan, the teacher say, shut up. Oops. I put my head in, right? Or they maybe say, you cannot get in the bathroom right now. It's like, why? I need to use it. But is somebody training them about the rules? Is somebody telling them what is okay, what is not okay? Is somebody welcoming in the proper way? Do we have the resources again? So coming back to the study. So we have data for 94 students, Goshen High School, Elkhart High School Freshman Division, and Pierre Moran. Average age 15 years old, almost 50-50 boys and girls. This is very interesting. Average length of time in the United States, 1 year. Less than 1 year, 65% were less than 1 year. Right now, I am in Goshen running this program. It's interesting that he just arrived last week. So that is something that, a little parenthesis. Saulo mentioned 58% of the kids' first language in Goshen High School is Spanish. When you think between January and March 30 of this year, and you hear that 103 new students arrived to Goshen High School, immigrants, first time in the United States. So you can conclude, you can make your own conclusions of the challenges that the school corporation are facing and the challenges that me as a student, one of that 100 kids, are facing. Just keep that in mind. Countries of origin, Honduras the majority, Mexico, Salvador, and as I say, this is 2022, but we have seen a huge increase in Venezuelan people, huge. That changed as well the adaptation of me as a provider, because you are now asking me, you guys need to stop thinking in Hispanics. You need to start adapting your system or the way that you serve the community. Those are Venezuelan. What that means? Parents come with the kids. Parents are professional. Parents advocate for the kids' success. Parents don't keep their mouth shut. Parents are gonna get what they want for the success of the kids. So that is going to affect completely the way that I as a provider serve those kids. So then we as a providers get a big challenge, but challenge at this level, so we need to get more. And I invite you guys to stay later because we had a great speaker. I'm looking over there, Nicole from Venezuela. She's gonna be after lunch, and she's gonna share her short experience. But that's why I wanted that as well. We listen to others. Data collection, so we had 246 surveys. Remember we say 94, why? Because we do a pre-test, post-test, follow-up test. So we do that data collection in a period of 5 months. We have open-ended questions for the qualitative analysis. We had focus groups with providers, with students, with the school corporation administration. We have interviews, and we have some notes from the social workers who provide that individualized sessions, de-identify. So we use the surveys. Something very quick to mention about the surveys here is that we use surveys that can be comparable with other statistics at the national level, Indiana level, and local level. So then we can really see the changes. And those are tools, if somebody here is into research besides Dr. Margarita, so then it's all the tools that we were working on for the qualitative and quantitative analysis. 34 total questions the kids completed. We realized that when they completed online, they feel more comfortable and kind of more quicker, move it quicker. When it's in paper, you know, we had people still that we need to tell them how to, how to operate the computer. We had questions about self-esteem, knowledge, perception. We have some open questions about coping mechanisms when we are talking about stress, anxiety. We are talking about maladaptive health behaviors like smoking, vaping, alcohol. And we include some questions still of COVID because it was 2022. Very quick here, I just wanted to point it. Let me see if I can point it with this. Yeah. So these four, if we look at these four, so we are looking at pre, post, and follow-up. So we can see an increase here, positive increase. So we see an increase is because it's positive. We see how kids improve their self-esteem, the social support, participation in extracurricular activities. So that's why when Nicole is gonna be presenting, it's important to share with us how to involve those kids in that opportunities at the school. So then that is important, but something on the bottom. So the reduction is a positive impact of the class. So we see here, I wanted to point it first at all that when we are talking about maladaptive behaviors are between 1 and 5. So it's not like a lot of presence of smoking, but the nice thing is that it's a reduction, that is a positive reduction. Smoking, vaping, alcohol consumption. But something that I wanted to point at is how once we leave the school, this increase. So it's the need of resources so we can have some kind of intervention so then we can keep the kids being aware that that is no good. Unfortunately, because we don't have enough resources, we find kids that the only way that they get acceptance in the school corporation is doing what the others are doing. Oh, I'm gonna start smoking because he's cool, right? I cannot say that my coping mechanism is to pray because they are judging me. The coping mechanism has to be like a go and drink or let's start vaping. So then it's different things that how we can rescue that beauty of the culture that they bring and not letting them to get contaminated on some situations that are out of their control. And sometimes it's kind of a rule. It's like a norm that they say, oh, I see each time that I get in the bathroom, somebody's vaping, so maybe that is normal. So that is terrible what we had to face sometimes. And I am a mother of 13 years old, so that's why it touched my heart. I already talked about that. But I'm talking too much. So I wanted that you guys help me with this question. What are some common stressors? Oh, I lose it. I need your help. Dylan, help. So everybody, if you guys can take your cell phone out, we are going to do a little quick. That one. So you can go and read the QR code that is going to be soon. So just, hello? Yeah, if you can be ready with your cell phone and read the QR code and help me to answer that. I wanted to see what is your perception of the common stressors that Hispanic youth experience. Okay, so as we can see, it is clear that number one, we can see the top 5 that as a group we recognize: language barrier, feeling unwelcome, nobody to talk to, isolation, dysfunctional families, as Dr. Alegría was pointing. So we have that clear. We are trying to adopt ourselves to a new culture, but our families still keep in that little shelter like the little turtle, and we don't have a choice. We have to go to school. We need to interact. We need to keep doing things. So yes, this is informational, but thank you for your participation. There is another one coming, and that's it. Just one more one. For making fun, it makes longer. I'm sorry about that. Okay, so now we are going to start with the results, the qualitative results. So the first thing is that we were asking about the stressors. What stress the kids? So the first one, as we identified, was problems with education. So we can see that just the fact to go to a school is 38%. 38% of the kids say, that made me stress out. I'm going to give my example. I'm from Colombia. My school was 1 classroom per grade. And we are right here to Goshen High School is, how many students, Gabby? 1,000, 2,000? 2,000? 2,000. I get just stressed out to see that many kids. We had recess in Colombia. We can go out and play soccer and play basketball and walk and breathe. And here you are in a hallway. That stressed me out. When I arrived to teach Bienvenido, that is between lunches, I was like, oh my gosh, I need to reach that classroom now because it's packed. So imagine all that trauma triggers that the kids are facing all the time. And then on top of that, the school size, the assignments, of course, the grades, I don't get good grades, exams, problems with loud noises. This is very interesting. Again, it's a trauma trigger. Remember that we are talking about kids that in their majority are coming to the United States by themselves, crossing the frontier in a long journey. Be quiet, don't move, stay there. We don't know what they are facing. And then they are right here and they cannot handle yelling. You wanted to, right, like a trigger that behavior, yelling, repeating, do it, do it, do it. Why you do it? Why you're not as good as this? Arguing, talk too much. There are kids that when they are talking to the therapist, they say that they cannot handle to hear a child crying. They can't handle that. Problems with isolation, to be alone. Nobody to talk, to be at home, alone, to be ignored. Problems with reaching goals, problems with social circle, they don't have who to talk to. So that's why this little exercise of Bienvenido, when I assume, I say, I thought you knew it. No, sometimes we see in the hallway, but we don't talk. So how we can create that social support, how we can create that protective factors that Dr. Alegría were mentioning. Overthinking, problems with English. We need to give a special category with that. I have been here since 2002, and you can hear my beautiful accent. And if you do a little research, you will realize that if you come after you are 12 years old, that accent is going to stay with you. But happened that I arrived as a professional, as an adult, and I knew what I was coming here to do. I knew that I was going to come here to do something good for my life. But these kids, they need that lifting. So what are we doing to lift them? How can we make a difference in these lives? But they are just building their self-confidence, just building their self-esteem. Problems with family, bullying just because the way that I look, because my black hair, because I'm shorter. My daughter is shorter. She doesn't have any accent, and they still is bullied. How is the weather over there? Do you think that she appreciates that? She doesn't. But they repeat it continually. And for the school, there is no bullying. So think about it. What can I do to make this environment more welcoming? I think that I'm going to skip this one for time purposes, but I hope that you enjoy the other one. Then we are also asking the kids, what strategies do you use to deal with stress? What do you do? Relaxation techniques, breathe. They breathe. They relax. They go for a walk. Remember that I say we need to breathe. We need to, but the recess is inside the classroom, inside the hallways. Calm down. Take a cold shower. Confine in trustworthy people. They don't find with who to talk. I was connected with what Dr. Alegría was mentioning in the study from Notre Dame, that the majority of the kids were born here in the United States. For this case, you notice that is the opposite. Just 15% of those kids were born here in the United States, and the rest are coming from other countries. And these 15%, they still feel the same barriers that we felt, because they just were born here. Right now they don't notice the difference to be a citizen. They will feel it soon. What is the difference as a benefits? But I'm just saying it's like sometimes not even where I'm coming from. People ask me, where do you feel? I say, I don't know. I feel like I'm not from nowhere. Like I'm not from Colombia. When I go to Colombia, they even say that my accent is Mexican. So it's like, I don't know. And I don't feel bad about that, but it's kind of funny that I perceive changes in my voice, my tone of voice. Self-improvement, think, find solutions, study, assignments, trying to find support, listen to music, avoidance, distraction. They try to avoid the conflicts. They try to avoid to talk to teachers. They try to avoid to ask questions. Exercise, screen time, so they are connected more in the cell phone. Sleep well, go out. Hobbies, and maladaptive behaviors. They listed that. Religion. So methods of improving mental health, that is also listed as a question. Speak. They had to confine in trustworthy people. They need to speak. They need to connect with family. They need to play. Self-improvement by thinking. I need to start thinking what I'm going to be doing in my life. I need to start planning to do better, to think in my health, to eat healthier, to think positive. Self-care, eating healthier, sleep, exercise, participation in enjoyable activities, visit a mental health professional. I love that, connecting with what Dr. Alegría. So what we do here in Bienvenido is to stop thinking that this is a taboo around mental health. If I go with a social worker, doesn't mean that I am loco. It means like I am overwhelmed. I wanted somebody to listen to me. And that is very important. So that is something that we openly talk in the classes. And here I wanted to point it that is the mental health that is over there. So it's not in the top 3, but it's number 4. Like how we can see an increase of visiting a mental health provider between pre-test, post-test, and follow-up. So now, what is the impact of Bienvenido among Hispanic immigrant youth? So first of all is connection. So we are creating a community of solidarity. Just the fact that the kids are able to talk in their language and they feel that they are able to explore opportunities for their well-being. Bridge and school, build a bridge between the school administrators, staff, students. So that is important because then as well they can see how coalitions like the NIHHC can support their needs. Also building confidence on those kids. They can feel that their peers can help them as well. Opportunity to speak in Spanish. I think that you remember 5, 7, 10 years ago that was not permitting the schools to speak in Spanish. That was punished. Remember? So imagine that. So now it's like, at least I can say buenos dias, bye, adios. And empower. We need to keep those kids here to be proud that they are Hispanic, proud of their roots, proud of their accents. But we as a community, that Saulo was mentioning, do we feel safe? How can we retain those kids that they decide to play, to work, and to live here in Elkhart County? Are we doing something wrong, or can we improve in some ways? Normalize mental health education when we are thinking about that. So I already mentioned that. Acknowledging experience affecting mental health. How can we access to additional individual support? And I wanted to bring this tool today for you guys. That is one that we just got the prints yesterday. Feel free to ask for more copies. But this is as well resources that is going to help our kids and our families to provide a guidance or where to go or what to do. Learning experience, adaptation, so how we can improve the acculturation strategies, improve self-esteem. And I think that I'm going to stop here because I wanted to share the video. Then it's not coming from me, but it's coming from the class when the kids are talking what is the Bienvenido program. Click in the no volume.
Why do we have no?
Our kids are going to come in, and we have constant families and children coming into our country. This is not something that's just temporary. It's an ongoing thing.
Mi experiencia al llegar acá en Estados Unidos fue bastante dura, debido a que vine sola con mi papá. Mi mamá y mis hermanos están en Venezuela y fue bastante difícil adaptarme sola a tantas cosas nuevas.
Our Bienvenido students come from a lot of different places, Central America, South America.
Soy de México.
Soy de República Dominicana.
Soy de Honduras.
They've dealt with an enormous amount of trauma. Part of it was due to their journey. The other part of what they've dealt with is, just the language barrier and not really understanding the customs, the norms here in the United States.
So they come traumatized because some have been sexually abused, some have been physically abused, verbally, emotionally abused. ¿Cuánto pueden con 20? ¿Sí? Some of the things they face is depression, anxiety. They have difficulty in transition. They have a lot of losses.
Pienso que lo más difícil fue adaptarme a la escuela y el inglés.
Lo que fue difícil para nosotros fue el dinero, conseguir trabajo que mi papá duró un par de meses desempleado. Casi a veces no teníamos que comer en la casa.
Bienvenido is unique because it is gathering a group of kids that already have something in common, which is we are going through something new together. And it is unique because we are talking about issues head on, such as emotional changes and depression and suicide and alcohol and vaping.
Liberarte del estrés, hablar con alguien que puede entender tu situación. Aprender me ha servido mucho para entender mejor la cultura de este país, cómo las personas se comportan.
La clase de Bienvenido me ha servido mucho. Aprendí mucho cómo valorar a otra gente, también saber si yo siento algo, comunicar con otra gente lo que yo siento. Le abre la mente a uno.
Gracias a este programa también me ha ayudado bastante en tener una mejor comunicación conmigo misma y con mi familia.
When you see students flourishing, that brings you hope, that tells you that the program is effective.
Bienvenido is helping not just the school system, but the whole community.
Estoy muy agradecida con la coalición hispana, con Bienvenido y con todas las personas que participaron y aportaron su granito de arena para ayudar a este programa.
Thank you so much, and I hope that this is inspiring you to keep helping our kids, Edwin, Nicole, Mariela, that they are present here. And there are many more immigrants that need an opportunity, but it's in our hands to offer that opportunity and open that little window. Thank you.
Thank you, Liliana and Dr. Alegría. Do we still have time for maybe one or two questions from the audience for Maggie or Liliana? All right, I see a couple in the back. Do you want to go first?
Yeah, I think my voice is loud, so I just want to say thank you for the hard work you've done for so many years, America, and that's why not Indiana. Okay, hold on.
You have more?
No,
Okay.
sorry, no, second one. That's what I want to say.
So one quick question that I have has to do with culture. It is very interesting that, the parents who are born in Mexico think differently about mental health, and they don't see their kids suffering from mental health, and it's the kids who are saying, yeah, we have more mental health problems than actually that the parents think their own kids have. And, I'm a son of immigrant, and one of the things that I discover is that my dad, whole concept of mental health was very different than mine. In fact, he was a workaholic and worked, not until he retired that he dealt with his own mental health and discovered that he suffered from anxiety and took medications and was a totally different person, totally different father, and then he realized, I wish I would have done something earlier in my own life. How can we help the immigrant community, the Hispanic community, take away that this myth of mental health and help them, not only the children, but also them as adults, to see mental health in a different light?
I think that one of the things that we could do is start doing more mental health literacy. I think we don't do enough, and we could do it in our churches, we could do it in our sports events. I belong to, I'm part of the scientific advisory board of Bring Change to Mind, and it's actually going to the schools and helping the youth also communicate with the parents. I think we also need the parents to really be more aware, because one of the things I really want to emphasize, we should actually say how amazing job parents are doing. So I actually don't want to take away from the parents. I just think parents are doing an amazing job given all the stresses they have. So we should actually be supporting more the parents and trying to see how we could support them. But I think we need to have more mental health literacy and bring the conversation to the parents rather than wait for the parents to have that conversation.
I will add something very short, and it's the importance of cultural awareness and cultural sensitivity both ways. We need to train our school corporations about the differences of the way that we grow, the way that we study. Yesterday I was with one of my staff social workers, and she was saying, right now I'm treating a child, excellent student from Mexico, here, right here, and every day is opportunities. Oh, you didn't bring the assignment? Oh, don't worry. Be sure that you return it before the period is over. In Mexico, in my country, in Colombia, the assignment is not done, it's a zero, big zero, period. So then we are changing the mindsets of what responsibility means. The assignments are the data, they had to be turned in, or at least we clarify that. But then we are building sometimes some behaviors that are not beneficial for those kids that are immigrating here. Another thing that I will bring as well to the consideration that was coming from the social worker is that I am treating a 10 years old, excellent student, and the school corporation making the partner of a child who just arrived. This child is overwhelmed because he's the translator. He's the coach of this child to be successful, and his grades are going downhill, but he feels that is his responsibility. I'm sorry, but that is not the responsibility of any student to make other students successful. They have enough busy life as students to be able to succeed. I understand that there are challenges, but those challenges has to be solved through other methods. I'm gonna share a little story that happened to my 13-year-old daughter. Science, a new girl. We're talking about pen, so it's not just LCAR system. Everywhere is the same problem. And the teacher of science assigned her to a child that just arrived, zero English. My daughter wrote an email to the teacher, Mrs. Ugeri, I don't know if you're aware that you have a new student who just speaks Spanish. I would highly recommend that you create handouts in Spanish for her. It is not my responsibility to be the translator. I am busy enough trying to cut off in my assignments to be here fulfilling my role as a science student. What happened the following day? Mrs. Ugeri showed up with handouts in Spanish. But how many kids have that ability? It's more like it's their responsibility, an extra assignment. But I feel that cultural awareness, cultural sensitivity trainings are fundamental. And there are organizations that can run it, including the NIHHC. So happy to do it, happy to help to grow the community as a better place.
Okay, thank you for sharing. One more? One more question? Okay. I think we'll do one last thank you to Dr. Margarita Alegría and Liliana Quintero. And then, as we all know, that we got the $50 prize for filling out the satisfaction survey. And so if everyone can do that one more time for this session, and then we will have a couple minutes of transition and try to transition quickly into the next session as we're a few minutes behind.